And calling the Human Services Committee meeting for Chautauqua County for August 16th to order. I would look for a motion to approve the minutes.
So moved.
A second.
Second.
All in favor?
Aye.
Aye.
Aye. Privilege of the floor. Is there anyone here for the privilege of the floor? Mary, did you want to speak to the privilege of the floor? Yeah.
Excuse
We have a discussion on other afterwards where it might not.
Appreciate it.
Sure. So just identify yourself.
Yep. Mayor Jim Jarzynski from the Village of Falconer. Good afternoon, everyone. And thanks for having me and listening today. As I told the committee before your meeting here today, I'm just here to reiterate coming last week to the county legislature meeting and speaking for my residents and asking for some assistance in the transitional housing situation in Falconer at the motel that's located in the Village of Falconer. So it's something that since even the meeting last week, the residents have just been commenting and calling and talking to me and other residents about the housing situation. And what I said at the public safety meeting is just asking for some assistance from Chautauqua County in working with social services, if the village is more than willing to be in on this also, and any other parties that need to be in on it to try to get that the Village of Falconer and this motel is not seen to be the centrally located one that everyone seems to go to. And as I stated previously, I'll try to get some numbers, and I imagine you can get the same numbers that just really what is being expended at the budget in compared to Legislator Proctor here mentioned that he had spoke with Diane. Is it Diane or Diana? Diane at Social Services, and they used 3 hotels in the town of Ellicott, the Clarion, the Colony, and the budget. Yeah, the budget. Well, one being in the Village of Falconer, 2 in the, and I mentioned the Quality Inn down by exit 13. I think was sometimes used. I don't know if it still longer is, but anyways, out of all those hotels and motels, it seems the one in the Village of Falconer is the one that's used the most. And for residents to be walking or just, being around in the village, sometimes they get approached about these things, about monies, this, that. As I explained to the meeting beforehand, it was just the other night, it was in the local newspaper about an instance where a business owner who has taken the time to invest in the village and try to better improve the village. Because we do have, as I said at the legislature meeting, we have things on the move in Falconer. We got investment in the Village of Falconer by private individuals, and we want to keep that going, and I'm sure it will. But just need some help and guidance and assistance from Chautauqua County as to with the transitional housing problem. And I do call it a problem in the village. So, but getting in that situation, she was in her place doing some revamping of it, and she had a gentleman that had exposed himself outside to her. Now, this gentleman has been arrested by JPD and I believe Ellicott PD on previous incidents, and obviously is in some need of some mental attention. And I just, it's his personal business, but I just wonder if he is being given the proper avenues. And when people are being placed there, whether it be alcohol, mental, or homelessness, are they being given the avenues to better themselves or to get out of that situation of temporary house, of that transitional housing? Because as I stated, I don't think you or I, just as citizens, don't want somebody staying in a motel, whether it be that one or any other one, for a month, weeks, months, years, and that's what it seems to be. And we all travel, as I explained to the public safety, we all travel, we all go to different cities. You know what a motel room looks like. Are there kitchens in there? Are there proper rooms for a family or for even 2 or 3 people? No, you don't have a kitchenette. You don't have any type of proper stuff. And for them to be in there over a week is just ridiculous. Because like I said, also, and I'm trying to get my 3 minutes in, there's been situations, and there probably will be here in another month, where I see school buses from various districts around Falconer, being Frewsburg, Jamestown, Southwestern, all picking somebody up in that parking lot, a school bus from Southwestern pulling into that parking lot. There's a family living there that's actually there long enough that their children's going to school at Southwestern or to Frewsburg or to Jamestown. So again, I'll just close out by, I just would like some assistance. And I understand from Legislator Proctor that he's reached out, and Diane is more than willing to meet with myself and anybody else. And I just want to have a conversation about how this is, in my terms, being overused at this motel in Falconer. So thank you very much for your time. Thank you, Legislature
Yep,
Proctor.
and we'll be in touch
Yep.
on arranging something.
Thank you.
Yep. Any other privilege of the floor? Seeing none, we'll move on to proposed resolution number 1 to amend the 2023 budget to implement the IT upgrades for public health project within the Chautauqua County American Rescue Plan Act, ARPA spending plan.
Good evening. I'm Dr. Mike Falk, Chief Medical Officer, Interim Public Health Director. And I would like to take the opportunity to introduce you to Lacey Wilson, if you have not met her. She is the Public Health Department's new Deputy Public Health Director. So instead of
Hey,
letting
Lacey.
her introduce herself,
Hi.
I figured I would do that. So.
I appreciate it.
We should make her do it anyhow.
I want to preface the 3 resolutions by saying thank you to the ARPA committee, our new and previous budget director, and the director of administrative services for bringing these ARPA requests back onto our radar. I think with the change in leadership over the last 7-8 months, there have been obviously a lot of changes throughout not only the health department, but with some of the restructuring of finance and other departments. We are now realizing that there were approved ARPA funds and proposals that we needed to do some work on. So 3 of them are on the agenda. The first I will talk about now. This is to a budget amendment to implement IT upgrades for public health. The original request was for $110,000. This really was to address 4 or 5 different facets of technology and information technology. We collectively, a couple of months ago, with the leadership of the health department, really took a look at these original requests and tried to kind of wrap our heads around kind of where previous leadership was coming from. And I think there were some really important things on here that the department was requesting at the time. However, with our sort of reprioritizations and our strategies that we're looking at now, we wanted to put some of those other things on the back burner. What we have decided and what we would like to spend that money on essentially are some updates to our Surface Pros in the amount of that you can see on the resolution. I think is $10,303, which includes 6 Surface Pros with chargers, docking stations, cases, keyboards with stylus. So we are often out in the field, whether it be with now our mobile health unit, rabies vaccination clinics, and things like that. We were in real need of some upgrades for portable equipment to access things like our electronic medical record and things like that. So, reluctantly, we made the decision to try to keep 10,000 or so of that $110,000 and very likely put remainder of that money back into the ARPA pot. So that's kind of where we're at.
That's good. Any questions, concerns? Appreciate you giving back.
That's not very common. It's great.
Well, yeah.
Well, yeah. Okay. No questions or concerns? All in favor?
Aye.
Aye.
Okay. Proposed resolution number 2 is to amend the 2023 budget to implement the PPE replenishment project within the Chautauqua County American Rescue Plan Act ARPA spending plan.
So the original proposal requested $90,000. The ARPA committee recommended and approved $60,000. And I'll read kind of the description here of the rationale. The COVID-19 pandemic forced us to realize that we must maintain a current stock of PPE in order to be ready for addressing similar public health emergencies, which could be a wide array of different types of urgencies and emergencies. Our PPE stockpile is, really assessed every month, and we have to renew that every year because of expiring PPE, personal protective equipment. PPE stands for, which all of you probably know. This includes basic things like gloves, gowns, masks, surgical masks, N95s, but it also may include things like vests, body bags for a corner program, different types of suits and respirators, privacy screens, and related supplies. The original request, again, was $30,000 a year over a 3-year period. What we are requesting as a budget amendment, expenditures of $60,000. I think there was a little bit of confusion because we do have until the end of 2024 to spend this money. I think my initial thought was $30,000 this year, $30,000 next year, but I think the resolution did come through at $60,000 budget amendment for this year. So I'm assuming that would mean we'd have to spend the $60,000 this year. That's what I'm assuming, the way the resolution states. So we can do that. I have engaged our emergency preparedness folks within the health department, and also in collaboration with Noel Gutman from Emergency Services, Dan Imfeld from Emergency Services, and our hazmat team, and looking sort of what our needs are from a PPE perspective. And what I mean by that is there are probably some bigger budget PPE items like Ebola suits, PAPRs, which are powered air purifying respirators. These are things that are used for long-term protection from particulates, whether it be, viruses or smoke or other toxins. In addition to that, level A suits, which are basically protecting against toxic chemical vapors, and level B suits, which would protect basically respiratory splash protection, things like that. So these are kind of high-level types of suits. When speaking with emergency services, the PAPRs that we have as a county, so these powered air purifying respirators are 10 years old. They're probably, the rubber on is probably no good. The masks are not up to date. And they have reached their life. They're about $3,000 a piece, and we probably should have, and they have now in stock about 6 of those. So that's pushing $20,000 right there. The level A suits are approximately $1,800, and we do have some shelf life left on the ones that we have, but but they really should be updated. The biggest need are level B suits, which would probably be more commonly used. And we would require 12 of those at $300 a piece. The other needs and the other part of the application for this was PPE for our coroner program. So things like body bags, which would include PPE, pants, boots, Tyvek suits. The Tyvek suits can also be used during emergency preparedness operations. And then the basic stuff, the gloves, the gowns, the N95s, and not only N95s, but a variety of sizes. When we got started with COVID, we pretty much had one size fits all for everybody, which was not ideal. And certain types of masks. So in speaking with, all involved, we would have no issues with these expenditures this year. And I think it would be a great, opportunity for some collaboration between departments. There's really no reason for both of us to buy the same equipment. It's not used often, but when it is, something not good is happening.
Dr. Falk, I don't mean to speak for the budget director, but I believe once these funds are appropriated to this project, they can be carried over to the following year.
Yes, yes,
All
thank
right.
you. I was going to chime in and say that. So
Thank you.
if by chance you don't spend the full 60 this year, they can be carried forward to next year. To be honest, if you can spend more than the 60 this year, you can appropriate the full 90 that's allocated to the project.
Okay.
What's really important is that those funds are either spent or encumbered with a purchase order by the end of 2024. That's the important date to remember.
All right.
So
For this, I don't
I
think.
think
we'll
this
have
is a
any problems.
$60,000 project.
is it? I thought it was 3 years at 30.
I think there's only 60.
Is this
I
a
think the.
is it a
I think the
60,000 or a
original
90,000?
amount that was applied for was 90, 30, 30, 30,
Okay.
but the committee approved 60.
Yes.
Oh, okay.
Correct.
I apologize. I misspoke.
But being
Okay.
that
So,
we're-
okay.
yeah.
So you're already putting the full $60,000
Yeah.
amount that was approved. So
Yeah.
yes, it can be rolled forward to next year.
That's good
I
news.
apologize. I misunderstood what you said.
That's kind of where we're at with that.
Well, I was going to ask that question on what it can be rolled over. And if that presented a problem with expiration, what are the typical expirations, which I'm sure they vary from
Yeah.
piece to piece, but
Yeah, we have a spreadsheet with all of the expiration dates. The shelf lives for things like, gloves and masks are generally 5 years or so.
Oh.
But we are constantly having to replenish those, depending on, when they're
Usage.
expiring, and the usage, So we really would like to, in discussing with emergency services, I think we have some opportunities to work with not only our paramedic, our CCEMS, but also local hospitals. If we have boxes of gloves that are going to expire within 6 months that we're just going to end up tossing anyways, we may have some opportunities to work with our local hospitals to get them those resources as they'll burn through them a lot quicker. The bigger ticket items have a much longer half-life, so, or shelf life. rather.
well, the Pampers, we
Yeah,
were talking
Pampers,
about, they're 10 years old,
Yeah.
but they're at the end of their life.
Yeah,
But do they
They're
have
getting
expiration
there. They could
dates?
probably be used, but I don't know if I would want to be the one probably being
Using.
okay.
No.
Yeah. So
Do the masks have expiration dates too?
they do. I just don't know when. We have an individual within the health department who, pays attention to our inventory and our stock of everything, and keeps everything up to date. So we would appreciate at some point in time. I think that there's some technology that we can tap into to keep track of our inventory, as opposed to somebody kind of like counting
No, that'd be nice.
spreadsheets and stuff like that. So again, we are working with Noel Gutman, looking at some of the inventory tracking products that he may be looking at as well. So we're hoping to be able to implement some of that within the next year as well. So,
And I will also throw the suggestion out there. If you do have things like gloves that are getting close to expiration, I know that the jail, the corrections officers in the jail buy them a lot, and they're often on back order. So
yeah,
just a thought that could be another
Yeah.
happy
that's- yeah, no,
recipient
we would- we'll
of those
definitely
gloves.
Yeah, we'll definitely send them over that way, for sure.
The expired suits and such, will they be completely disposed of, or is there a place that you could?
Might have to explore that. I'm not sure. There may be some lower level uses of them out there somewhere. You know,
Training.
I was saying training, yeah.
type things, yeah. Gardening.
Beekeepers.
Yeah, that's right. That's
But
right.
if there was some kind of software, like you said, to keep track of it, you could get notification ahead of time when they're about to expire, or
Yeah.
get rid of them, give them to somebody.
There is that, that technology exists, and I think we
Yeah.
want to kind of look into that. So.
Yeah, that'd be great.
I think that would smooth out the budgeting process too. Like,
Yeah.
Okay,
Right.
next year
Exactly. Then you kind of know, and then
we need
you
a
have
1,000
historical
masks.
data there to kind of take a look at everything for sure.
So you know ahead of time, right, when you need to order again. So things.
Okay, any other questions, concerns?
Mr. Chairman, I would just add a comment that although the funds can be carried over to next year, we certainly appreciate you putting them to work as soon as possible. Because we've had these ARPA funds for quite some time. And my personal preference is I like to see them put to work as quickly as possible.
We will take note of that.
Okay. All in favor?
Aye.
Hi.
Aye. Thank you. Brings us to proposed resolution number 3 to amend the 2023 budget to implement the lead hazard reduction project within the Chautauqua County American Rescue Plan Act ARPA spending plan.
Hello.
I'm going to ask Anna Powell to present this resolution.
Thank you, Lisa.
Hi, I'm Anna Powell. I'm our Childhood Lead Poisoning Program Coordinator. I also manage our HUD Lead Hazard Control and Healthy Homes Production Grant funds. So we requested these funds initially for another project. We met with the ARPA committee and reallocated them to where we think we could best use them. But I can let you guys start. If not, I'll talk all night. So what questions do you guys have?
Well, the original request for, find my paperwork here, and kind of give you just a little bit of a background. The health department requested these funds to reduce lead hazards in homes. Okay. The money, this money, and that was not the original request for the ARPA funding for the same amount of $700,000. It had also included not only lead remediation abatement, but also fixing holes in floors.
Yeah, just general healthy housing issues.
But with what we realized with increasing costs, increasing shortages of contractors, I think we came to the realization that probably was not a realistic approach. So that Anna went back to the committee about 6 weeks ago, a couple months ago, and reapproached this. And really what the emphasis is on is the money being used for high contact areas. The biggest risk for lead are those things like windowsills, doors, and things like that. And so we're looking to use this money for window and door replacement in units that we have recorded lead hazards. So these are either, dwellings that we know have been tested heavy for lead, or have children who have tested positive with elevated lead levels. At this point in time, we have approximately 300 open prevention and intervention units that need some type of remediation. These funds will assist the property owners in replacing windows and doors, as well as providing paint and other remediation supplies. The funding will provide adequate training for staff, property owners, contractors, maintenance crews to provide remediation in a lead-safe manner. These funds will also cover the costs of clearance testing, outreach and education materials, and blood testing supplies for children in our county. We're looking at this point in time in hoping to, at least estimating getting into about 56 units at about a cost of $10,000 a piece. That's obviously, the vast majority of that $700,000, $560,000, but also $60,000 in training, $44,000 in operating fees, $20,000 in outreach and education, $16,000 in blood lead testing. So the resolution is asking for a budget amendment of $36,000 for this year. Again, I get back to, we needed time to kind of bring this back on our radar through this transition, make some modifications with the realizations of costs right now, and really try to make the most impactful plan that we possibly could in getting out to as many homes as we possibly can. So that for 2023, we're talking spending $5,000 in Job Corps classes. Anna can kind of brief you on what that means. We have lead testing machine. It's basically like a lead gun kind of to test surfaces for lead. Obviously a very expensive machine that requires a lot of maintenance and calibration. In 2023, about a $15,000 cost. We have old HEPA vacuums that need replacement, 4 of those at $2,000. And then also monies allocated for events, for education, outreach, educational booklets, and other community type of outreach in the total of $36,000 for 2023. So I know the elephant in the room and the burning question in all of your minds is, what about the rest of the $665,000 that you have 1 year to spend? And that's where I'll kind of let Anna kind of talk to you about what her plan is. She has convinced me that she will have, what did we give the state back, 23 cents recently?
I have maxed our lead budgets out so much that we're utilizing all of our funds for our current work, right? So we have all of these backlog of cases, but we still need the funds to train the people of the backlog of cases and then move forward and kind of bring our program up to date with some good outreach materials and, provide them vacuums that actually work. And because we do offer a free vacuum rental. So you don't, okay, I'm going to go off on a tangent here. So for lead remediation, my goal is to either run a window and door replacement reimbursement program, or we can contract with a supplier and pay them upfront for those windows and doors. Then with that model, we're going to be able to train landlords or property owners to put them in a lead safe manner. So I think what a lot of people don't particularly understand about lead abatement is the training that goes into hiring the contractors to do it. So as soon as you hire a contractor to do it, you're doubling the price because they have to provide containment and they have to provide cleanup of that project. So the $10,000 at 56 units will be great. We can still spend that. We can make a dent and assist property owners in replacing those high friction and impact surfaces. The other model that we could use is to RFP a crew of abatement contractors to go in and do the work for the property owner. That will increase the cost, so we're going to touch less units, but the money will still be spent. We're going to spend the money either way, regardless of which model that we choose to go with. Because lead abatement work is quite dangerous for the occupant of the program, hiring some lead abatement contractors through the county and having them on staff would be beneficial to complete these projects. But I'm confident that regardless of which model we went with, we would still be spending that money.
So this is more than the old just seal up the lead paint with something.
I have
and-
absolutely 100% got away from that model.
And it's
So-
replacing everything, the windowsills and the frames and everything.
Right. So what we have improved in our policy and procedure in our program, New York State adopted a blood lead level of 5 in October of 2019. That was dropped from the level of 15. So our department has went from responding to between 12 and 15 elevated kids per year to between 60 and 80 children a year the past 5 years. That's a lot of work. And with that, we have seen that by just allowing landlords, property owners to just go ahead and repaint windows, doors. I mean, think about it. If you went and repainted a window in your house and you open that window 3 times, what is it going to look like? It's already going to be deteriorated. So we've changed our policy and procedure that those high friction and impact surfaces, windows, doors, floors, stairs, they all need an abatement treatment. So that means whatever they do to remediate that lead hazard has to last for at least 20 years. So just by repainting surfaces, that's not adequate anymore. We're spinning our wheels and we're now going into homes that we did prevention inspections on 6 years ago. We have lead poisoned kids there because nobody replaced the windows. We just repainted them. And while that's effective, but you have to keep repainting, right? It's only as good as long as that surface stays in stabilized, right? But as soon as it starts to deteriorate, then it's posing a hazard again. So in that case, we would have to go into a home every year to say, and we just don't have the staff to do that. So by going in and actually spending the money to replace these items, we're going to save ourselves work 5 years down the road because we're not going to be going into those properties again. That's what I'm also trying to get through HUD's brain because HUD, our lead hazard control program, is technically an interim control program. We have a lot of high cost units, but it's because I'm not allowing certain surfaces to be interim controlled. We're not making a temporary fix. We're going to fix it right the first time. And that's our goal. And that's what I would like our goal to be at the county level too.
So it's preventive.
Absolutely.
Moving forward, yeah.
Absolutely. Because right now we have we respond, right? We're not really doing prevention.
Reactive, yeah.
Yeah.
Makes sense.
That being said, there's coming down from New York State, there is a rental registry for our area coming down the line next year, where it will, any unit, 2 units or above will have to have a lead inspection and be deemed lead safe every 3 years. And this is going to make the biggest difference. Rochester has seen this model work by enacting a rental registry in the city of Rochester. They decreased their lead rates, their lead poisoned children rates by almost 85%. So I'm sure you'll be seeing us a lot more with all of that coming down the pipeline.
And that's coming from New York.
That's
Okay.
coming directly from New York State. We will receive funding from New York State to implement that program and hire more staff. And, but yeah. They also have remediation money coming from that too. But I know you guys I'm sorry.
No, you're
Good.
good. This is
Well,
great.
just Anna's going to stay on to discuss
Yeah.
more of this in a discussion.
Yeah, so we can-
So we can talk a little bit more about that. Any more questions, concerns on this
The resolution.
resolution? Okay.
Mr. Chairman, Anna and Dr. Falk have heard these comments from me at the ARPA meeting, but I support their new approach. I think it's a good approach. It's just that I just wish it could happen quicker. Because we know that in this county, every day, children are being lead poisoned. And the quicker we can implement preventative measures, the better I'll sleep at night.
Thank you for your support.
I'm the one that advocated for this project, by the way.
Thank you. Anything else? All in favor?
Aye.
Hi.
Okay. So.
Yeah.
Anna, you're sticking around?
I'll
Is
stay right
Lisa?
here and we'll bring Lisa Schmidt-Farrick down as well. She's our Healthy Homes consultant for our lead program.
So we got like about 20 minutes before
Oh.
CED meets, so. I've asked them to come in and discuss, to start the conversation on what you're planning on doing.
So I'll let Lisa go first. We usually have we do very well at tag teaming and talking about lead poisoning. And then I talk about all of our programs and efforts at the county and what we're doing and our goals for future projects as well. So go ahead, Lisa.
So because there are new faces here since the last time we were in to talk about childhood lead poisoning in the community, and because we have some updated data, I'm just going to share some of that information briefly. And if you have questions about any of it, by all means, ask. So, the reason that we talk so much and are working to address lead poisoning in our community is because of the problems that it causes for children. Typically, lead exposure will cause at different levels, and depending on the child and a lot of other factors, can result in irreversible, but 100% preventable, basically brain damage. So children who are exposed to lead, particularly at higher levels or low, long-term, chronic, low-level exposure, will manifest issues like attention deficit disorder. They will have overall decrease in IQ points, processing kind of problems, impulse control sort of issues that will follow them through their school years into their working lives. There's a demonstrated association with lead exposure and being a victim or perpetrator of gun violence. So these are problems for our community that we will be paying for the long term. So really so important to understand that this is very serious. If you talk to families who have children who have been lead exposed at levels high enough or long enough to cause these kind of issues, it's extremely frustrating. It's similar to really any other issue of being a parent of a child with a disability, and trying to get those services and the impact that it has on the family, the impact that it has on schools, on classrooms that these children land in, and the issues that, cause from some of the behavior problems. So, we take it seriously and keeping in mind that this is 100% preventable. We should not in 2023 be standing here talking about 2023, standing here talking about this as a problem, and we still are. Lead paint was not banned for use until 1978. It's prevalent in it can be prevalent in any home built before 1978. That's over 80% of homes in our county. It's especially prevalent in homes built before 1940. The median age of housing, I don't have that figure for the whole county, but I know for the city of Jamestown, the median age of housing in Jamestown is 1939. So, yeah. So we're talking about some of the oldest housing stock in the state, and New York has some of the oldest housing stock overall in the nation. So that's what, Anna and her team are really up against. We're seeing it's about 85 per year children now, Anna?
Yep.
80 to 85 children per year that are potentially impacted by lead exposure. And those are the kids we know about. The other thing that we've seen over the past several years is actually data showing a decrease in testing rates to the point that 4 out of 10 children in our community aren't receiving their recommended lead screenings. So that's another kind of issue that we're working to address.
Why not?
It's a variety of factors. I can tell you that our pediatricians work very hard to get those kids in for their screenings. But we have families that are leading difficult, complicated lives, and the folks that the mayor referred to who are in, hotels and it's not the top of their agenda, or their capability. I know Dr. Falk is working hard to, and Lacey, to get lead testing up and running in the health department, so we can provide some of that as kind of a backup.
And that's a great use of our mobile unit vehicle. We can go right to these communities and offer lead testing right where they are, because that is a big issue, is getting the families to actually go to the lab to get their blood work done.
So there's some system kind of changes that could take place that we're working with our pediatric practices on some of those, and they're responding. It's it's just a little bit. It's just concerning to me that the screening numbers have dropped. But we also hear anecdotally, and we can speak more to the greater housing problems. We have heard from community partners that families that they're working with have been told by their landlord, oh, don't bother getting tested. It just causes a whole lot of problems. So that's the message. A family who is, at risk of homelessness a lot of times is hearing from their landlord. They don't want to rock that boat. We have had, again, anecdotal or situations of landlords who are asking tenants to sign off on having any responsibility for the lead exposure. So we have really kind of some deep-rooted issues to address here. Just a couple more kind of placing this in understanding. Chautauqua County is about the 6th highest rate of childhood lead poisoning in New York State. The 14701 zip code specifically is the 7th highest zip code outside of New York City of number of lead poisoned children every year. And the burden is really kind of in the city of Jamestown, and it's a function of the older housing stock and just years of disinvestment, increasing number of rental properties, a whole lot of things happening there as well. I'm trying to think if there's any other kind of important points. I think on the positive side, some of the work that we're doing, and we can speak more to, is we have a healthy housing coalition. The focus of that is really very much driven by lead. It's kind of, if we can address the lead in housing, we're addressing a whole lot of other issues in those homes as well. We met today doing a strategic plan restructuring, or realignment. So we've got a new strategic plan moving forward into the next couple of years, and really engaged community members across the board on that issue. So any questions, kind of that big picture about lead exposure?
So the rental registry this landlord issue, you stated to me on our phone conversation.
So our current model really allows landlords to benefit from poisoning children. They're purchasing properties. There's no standard of housing whatsoever in code or sanitary code or anything that holds them accountable to at least have a safe home for somebody to live in. Being a landlord is a business, so there should be some sort of standard at which they have to run their business. And I'm not saying this is all landlords, but also keep in mind that out of 500 properties, there's 13 landowners there in Jamestown, right?
Homeowners,
So
owner-occupied.
there's a very small amount of people that control our affordable housing stock. In this, And this goes into what Mayor Jarzynski is asking in Falconer, right? Like, it's a full-scale housing issue because we don't have enough safe housing to place families.
Safe, affordable.
Safe, affordable housing to place families. So at this point, our landlords are being rewarded for doing bad business. At the health department, we have to, if you want to open a restaurant, you have to come through us. You have to get a permit. You have to show that you can serve people safe food. So why is it we are allowing people to live in atrocious conditions just due to a lack of standard in our housing in our area? So this rental registry is a start, but we need to keep in mind that the state is going 2 units or more. We have a ton of single family houses that would need to be addressed as well. So having support about maybe changing our sanitary code or assisting Jamestown, we've built such a wonderful relationship with the city of Jamestown and their code enforcement officers that, you know, we work very closely together because we're tackling the same issues. So, you know, working with them to even, they have actually been working on a rental ordinance in-house before the state came out with this. That's been one of their goals, to get that passed through council. Now they're not going to have a choice, right? So it's coming down from the state, but we can always strengthen at a local level, right? We can strengthen at the county level and we can strengthen at the city level. The city of New York City has some of the toughest lead clearance testing, whether it's testing or clearance levels for dust wipes after remediation. And they've put this into place for years, really, with a lot of success. So we can always be a little bit harder. I think our New York State rental registry is a great start.
That's only for Jamestown.
And that is only for Jamestown. That's not countywide. So we still aren't taking into account Dunkirk, where we do have, once the state lowered that lead level, we did see we have a lot of kids pop up in Jamestown, or, you know, even Westfield. We have a lot of old housing stock in a lot of the county. Those are just our focus areas. I had actually requested that we start providing newborn outreach letters to the city of Dunkirk as well, once that change in blood level was made and we started seeing those kids pop up, and the state approved that. So now we focus our prevention efforts really on Dunkirk and Jamestown.
That's a great start. And then we got a lot of other houses in between, but at least you could start somewhere. And at the county level, what can we do to support you to help with that?
You mentioned a change in sanitary code.
Right. So at the health department, we could potentially change our sanitary code right now. And so this is for our rural properties, right? If you're on a private well and septic, there's a point of sale property transfer inspection. So we have to pay, if you're selling your house, you would have to pay that $300 for one of our inspectors to come in, inspect your septic system and your well, and make sure it's all up to code and working properly. It's a push, but we could potentially do a point of sale property transfer inspection to at least identify the lead hazards. How far we would get with requiring remediation, that's really another conversation, because we really need to strengthen our enforcement, right? So there's enforcement issues that we issue a notice and demand when we find lead hazards, so the only repercussion is then to send the landlord to Board of Health if they don't comply. And traditionally, fines haven't been enough. I want to strengthen that, so we're fining them, like, I think it's $2,500 per day per violation, but there's really no enforcement after that. So if they just say we're not going to pay, we're not going to pay, right? So we need some teeth behind our like our legal system and housing court to hold them responsible. But again, I would love to see a property transfer inspection, because the standard across home sales at this point is, okay, yeah, they may do it was built before 1978. Do you know if there's lead hazards in your home? And it's perfectly acceptable for you to just check unknown.
At the very minimum, it would make the buyer aware
Right.
if there's lead hazards, and then
Right.
Knowledge is very much power. If somebody knows that there are lead hazards, then they're kind of on alert. If they do certain work, that they have to take precautions. You know, just because a property has lead doesn't mean that a child's going to be poisoned in that property. There are plenty of ways to very much reduce that risk to the child. But if you don't know that it's there, and we've had cases of somebody goes to town on doing a renovation project, and all of a
Start
sudden
dry
they
sanding
created a
their
dust storm of
windowsills.
lead
It's all
and
over, yeah.
terribly expose a child.
So a home inspection for a new buyer when they go to,
It
Has
doesn't
nothing to
address
do with
lead-based paint.
right,
And we have, I don't actually think we have, I think we're the only risk assessors in the game right now in Chautauqua County. There's no third-party companies or private companies that they're all like out of Buffalo. So it's very difficult for people to even really get an inspection, and it's costly.
And we have had people contacting us, not as much lately, but for a while I was routinely getting phone calls through associations that I had with realtors saying, you know, I've got a buyer, they'd like to get their home inspected. And, you know, we had to make clear we can't inspect vacant properties right now, or, you know, properties where there's not a child under 6 living in it, and they would need to find somebody, and they just can't find those people.
Like at this point, our grant programs don't allow us to do property transfer inspections. You have to sell the property has to close, and then the new buyer would have to call and request an inspection.
separate.
But we can only go in if there's children under 6 or a pregnant woman there. Right? So our hands are tied a little bit there with our current grant programs. But again, if we put into act a property transfer inspection, we would know every single, upon transfer, everybody would be aware that this is a problem. And with our area and the amount of issues that lead paint causes our entire community, like Lisa said, from the dollars that it takes for us to go in, provide care coordination, our early intervention team, and then they go to school, they receive special education services at school. And what's the cost between putting a normal child through school versus a special education child? I think one is $18,000 and the other one is almost $40,000. We're doubling our money at the education level. And then what happens if that child has impulse control issues and becomes a criminal? So then we're going to pay for them again.
And you're not going to know that unless you can do the right kind of testing and correlation and study and follow up to show that there was that
And we
direct
don't
link to the
have
lead.
great, yeah,
Right.
and right now we don't have great data management. We're working on that as well.
It's also the science of lead exposure
Yeah.
is tricky that way too,
Right.
because it's very much that Anna and I could be exposed to the same amount of lead at the same time and have different outcomes. There's not a set, this is exactly what happens at this level of exposure or whatever. So we're making you're making kind of population level sort of guesses as
Right.
to the potential. And
Are there other counties that have the property transfer requirement?
That I am not sure of. The rental inspection policy, yes, I actually meant to gather that today, but the city of Rochester has a very robust lead inspection, rental inspection policy.
I mean, like, you know, you have to check for radon, you have to check for all these different things. Why aren't we checking for lead? I guess is my question.
Right, right. That's where we really need to gain traction and make it known to all of you and possibly the bigger group of legislators. And really what we're trying to do is prevention. But we can't do that without some really robust changes in the way we operate, our internal policies and the way we allow landlords to do business.
But also, like you said, education and awareness is really important if people understand what the potential risks are. I mean, some people might look for it on their own that maybe hadn't even thought about it. So your idea about getting the word out and educating people.
I will,
awareness.
it's a piece of it. We cannot educate our way out of this problem.
No,
The
I
same way we
understand.
couldn't educate our way out of, high smaking rates and we still have,
Right.
25%.
I know it's a
smoking
small
rates or
piece of
whatever,
it, but it sure
It
can't
is.
But for
hurt.
some folks, yeah, and I think we're doing a pretty good job of raising awareness on
You
the
are.
community level and trying to get out there and reaching families and all of our partners. It's been one of the great things about the coalition is we've got Jamestown Community Learning Council who has staff in these homes. We've got other folks in early intervention with people working with families at all different levels who are, understanding this. And then really we're working in collaboration with a lot of them. And so my louder for the folks in the back piece of this is when we're talking about rental inspection and proactive rental inspection, it's very much about maintaining quality of housing and stopping this disinvestment that's been happening in housing and what appears to continue to be a problem. And that's an economic, detriment to our economy. It's a detriment to neighborhoods, quality of neighborhoods, and overall housing stock. Like at some point, we have to stop this.
Mr. Chairman, just for clarification, Anna mentioned the sanitary code. The sanitary code is under the control of the Board of Health. So for the legislators who thought maybe that we controlled it, I could see your wheels turning, Marty.
Yeah, the wheels are turning. Well, we need to wrap this up. We're 6 o'clock.
Thank you.
So,
Thank you.
to
Thank
be
you.
continued,
Thank you for coming.
And
Thanks for having us.
Board of Health next up. Do we have a motion to adjourn?
So moved.
Second.
Adjourn.
Good job.
Yeah, it's very nice. I mean, we check for so many things when we do transfer property. Why wouldn't we check for lead?
Are we doing that within the lake?
Yeah.
Septic.
I get it.
Hello, Mr. Proctor.